Hi, I'm Dr. Judy Frazier, and welcome to this segment of updates for the AME. Today we're going to cover items that have changed between June and September of 2017. Today we're going to cover medication changes, including Cialis, where the daily dose of 5 milligrams or less is allowed after a 7-day ground trial. The medication for diabetes, albiglutide, is also allowed. Sections that have been updated include there is a new insulin status report that can be found in the insulin section, and the vision section has been updated to show that the AME does not need to check both corrected and uncorrected vision. New policy changes include the addition of a breast cancer CACI, and there's been a significant expansion to the drug and alcohol section. Regarding daily Cialis, you'll see in the table that you can find in the pharmaceutical sections, daily Cialis is now allowed after a 7-day ground trial. So one more tool that's now in the AME guide is the Diabetes on Insulin Recertification Status Report. This report is now in the guide so that your treating physician, endocrinologist, family practice doctor, internal medicine doctor knows what information the FAA will require. So if the airman will take this to their treating physician, have it completed, signed and dated, the AME can accept this in lieu of a letter or medical records from the treating physician. This should significantly decrease the time that it takes to get a recertification on an airman using insulin. Regarding the vision section, the AME no longer has to ask the airman to take out contacts or pull off glasses. They only need to check corrected vision if that's what can cause the airman to meet standards. But the AME should make sure they report it in the correct column in AMCS and apply the correct limitation. There's a new breast cancer CACI. Remember to always start at the disposition table. In this case, it talks about if breast cancer was non-metastatic more than 5 years ago and there's been no further reoccurrence, you, the AME, can issue. If it's been less than 5 years, they could possibly qualify for the CACI program. All others, the AME would need to defer, and the list of required items is in the middle column. The breast cancer CACI worksheet shows that in situ tumors are the only ones allowed. There have been significant updates to the drug and alcohol section. That will take you to the new drug and alcohol main page. On the drug and alcohol main page, it's divided into 2 specific sections. One is general information for all AMEs. The other is information specifically for HIMSS AMEs or any airman that would need a monitoring program. So let's say you take a history from your airman. You identify that they had a DUI 4 years ago. The first thing you should do is go to the DUI disposition table. That's the first link that you see there. When you link to the disposition table, it will tell you as the AME what you can do. If the airman has a letter from the FAA saying they no longer need to be followed, you can note that in block 60 and issue a medical certificate. If the airman has had a DUI more than 5 years ago, but it has not been cleared by the FAA, you should obtain an airman statement. If you need to know the types of information that should be on the statement, this can be found in the cert aids. If your airman had a DUI within the last 5 years, we will need additional information. The information that we will require is on the drug and alcohol status report. If you use this report, it can help you as the AME determine if you can issue the medical certificate or not. If the airman meets all of the criteria in the left unshaded category, you, the AME, will be able to issue. If any of the criteria in the right or shaded column are checked, you will need to defer. This is the information that the FAA will need to be able to make a certification disposition. Remember, when using the drug and alcohol status report, you should also submit all of the supporting documents used to make the decision. So when using the alcohol event status report or when trying to obtain enough information from your airman, you may find a certification aid helpful. Certification aids are multi-page and each section describes what is required from that provider. Remember, if your airman had a DUI, they need to report it not only to the medical department, but they also need to report it to security. If your airman checks yes to any history of drug use, there's a new drug use disposition table in the AME guide. Specifically, if the information has never been reported, you, the AME, will need to defer. Now let's talk about the drug and alcohol dependence or monitoring section. This is the bottom section on the substance abuse main page. Remember, this is for airmen who have to be monitored by the FAA to continue flying. This is also associated with the HIMSS program. Step 1 for your airmen is to establish with a HIMSS AME. Step 2 is for the HIMSS AME to do evaluation and testing. If you are a HIMSS AME, you will need to submit the initial checklist. You can use the certification aid to help other providers understand what is required by the FAA. And remember, if you are working with a pilot who works for a HIMSS airline, you will need to also submit a data sheet. Finally, there are new drug and alcohol monitoring FAQs in case you have additional questions. So in summary, today we talked about medication updates, including daily Cialis that is now allowed, section updates specifically regarding vision testing requirements, and policy updates such as the new breast cancer CACI and a significant expansion to the drug and alcohol section. Thank you for joining us for this episode of Updates for the AME. We hope you find this information useful. Enjoy the rest of your day.